Okay, I hope everyone is doing really well. I'm back again. I'm just going to be doing chapter 12, which is part 4 of the musculoskeletal system. So the first bone that we have is the ox cossa. So it's important to realize that there is a left and a right ox cossa. So what I'm holding right here is a right ox cossa, and it's composed of 3 bones. So you have the ilium here, up top here. Then you have the ischium here. And then you have the pubis right here. So here you have the acetabulum. So it's formed by portions of these 3 bones. So again, that's the ilium, the ischium, and the pubis. So the acetabulum is where the head of the femur locks into place. And you can think of this as a socket where the femur articulates. So here you have the obturator foramen. It's just inferior to the acetabulum, which is here. Obturator foramen, it's formed by portions of the pubis and the ischium. Remember, this is the pubic bone. So there's a piece of cartilage right here that connects anteriorly in the front of the body. I'll try to show an image right here. So this joint is known as the pubic symphysis, where the 2 pubic bones of the body meet via the cartilage. Okay, so we're going to look at the ilium next. The first part of the ilium that we need to be aware of is this structure right here, which is known as the iliac crest. Then if you turn around here, you'll see there's like this little indent here. So the iliac crest is the superior border. Then you have the anterior superior iliac spine. And then right below this divot, you have the anterior inferior iliac spine. And the reason why it's anterior is this is the right ox cossa, and you have the femur here. And this crest points kind of anteriorly. That's why it's known as the anterior superior or the anterior inferior iliac crest, because it's anterior. Right here, what you're seeing is the sacrum auricular surface. So remember, if this is anterior, you have the sacrum right here, which is in the back, all the way below our spine. So this is the point of connection between the sacrum and the ilium. So right here, what you're seeing is the iliac fossa. Remember, a fossa is just a depression. So the iliac fossa is this large depression on the medial surface. So the medial surface would be on the opposite side of the acetabulum. So the acetabulum's here. This would be the medial surface. Okay, so next we have the ischium. So this portion right here would be known as the ischial tuberosity. And then right here you'd have the inferior ramus of the ischium. So it's connecting right to the pubis bone. So then you have the inferior ramus of the pubis right here, connected to the inferior ramus of the ischium. This would be known here. So remember, this is the pubic bone. This would be known as the symphysial surface. And remember, you have the pubic symphysis right here, which is that piece of cartilage. So it makes sense that this would be known as the symphysial surface. Right before the symphysial surface, you have the pubic crest here. And this would be an attachment point for the linea alba. The linea alba comes right down here. Okay, so we're going to learn about the femur next. In my opinion, the femur is a lot easier of a structure than the ox cossa. Personally, I find the ox cossa the most difficult bone to learn. So I think that just means you really have to study it well, maybe even check out like the 3D models online, or definitely come into lab and make sure that you can identify the structure. So the femur is also known as the thigh bone. It's the only bone in the upper leg. So you have the head right here. It's round and it articulates with the acetabulum. You have the greater trochanter here, large bony portion of the bone, which is an attachment site for lots of different muscles. Here you have the lesser trochanter, so that can be seen most easily on the posterior view. So this would be the anterior view, and this would be the posterior view. So the lesser trochanter can be seen really easily here. It's a little smaller than the greater trochanter. So right here on this posterior view, you have the gluteal tuberosity. So it's a somewhat triangular region. Here it's rough, you can feel it, and it's where the gluteal muscle is attached to. So following down from the gluteal tuberosity, if you just follow all the way down, this would be known as the linea aspera. So it's this long line or crest extending all the way from the gluteal tuberosity. And it's also a place where muscle is attached to. You should know that the head always points medially. It's going medially into the acetabulum. That makes it easy because you know that this then is the medial condyle, and this would be the lateral condyle. So you can see it really easily here. So this would be the medial condyle, and this would be the lateral condyle. And it articulates with the tibia distally, and it forms part of the knee joint. And then you have the medial condyle right here. It's also smooth and round. It's located medially on the inside of the femur, and it also articulates with the tibia distally. Okay, so just an interesting fact here. So when doctors refer to a broken hip bone, they're not typically talking about the os causa. They're talking typically about the neck of the femur, so this portion right here. So especially in older women who may have osteoporosis, a lot of the times if they do have a hip fracture, if they broke their hip, they'll break it right here. So there are a lot of bone density tests that look at the width of the head of the femur to determine the risk associated with their disease. Okay, so in my hand I have the patella, which is this little bone right here that's also known as the kneecap. So it's important to know that this is a bone. Your kneecap isn't cartilage, it is a bone, and it looks a little like this. So it's embedded within tendons, and the tendons come from the femur, and they come all the way and they wrap around down to the tibia. So the femur and the tibia articulate with the patella right here. If anyone was curious what a knee replacement looks like, I begged my 82-year-old grandma to send me a picture of hers. So here it is. Okay, so we're going to be looking at the tibia next. And the reason you know that this is the left one is because this protrusion should be pointing medially, right here. So when you do this, so that should be medially, and then you should know that the tibial tuberosity, which is this bump out front, should be pointing anteriorly. So that's how you orient yourself. So the tibia, remember we just learned the medial condyle and the lateral condyle of the femur, and it's the same exact thing for the tibia. So if you make sure that this tibial tuberosity is pointing anteriorly, you can put it right here, and this is how it articulates. So the medial condyle of the femur articulates with the medial condyle of the tibia, and the same is true of the lateral condyle. So the lateral condyle of the femur articulates with the lateral, right here, condyle of the tibia. So the medial and lateral condyles are found superiorly on the tibia. So they're flat and they're smooth. So this is the tibial tuberosity. And if you've ever heard of Osgood-Schlatters disease, what happens is you have tendons of your femur that connect down to your tibia, and especially in young boys when they have their growth spurt, their legs, the bones of their legs might grow faster and not allow the tendon to stretch enough. So what occurs is inflammation at the surface of the tibial tuberosity. Okay, here we have the fibula. This is the superior portion, and this is the inferior portion. So it's the lateral structure on the lower leg, and what you should realize is that this bone does not bear a lot of your body's weight. It's actually the tibia here that's bearing most of the weight, and that's because if you look at a diagram or an anatomical model, you will see that the tibia and the femur are in line with one another, and you'll also recognize that the fibula is much smaller. So this is the head of the fibula, and the reason you can tell it's the head, it's a little tricky, but it's a lot more square shaped. This kind of looks like more like a triangle. Okay, so I just wanted to show some of the actions. This would be flexion of the hip, and then if you're standing up, that would be extension of the hip. When you're doing like a hamstring stretch like this, that would be flexion of the knee. This would be extension, flexion, extension. Okay, so I just grabbed one of the ball and stick models from class. So this is a model of the ox costa and the femur. So when you're sitting in a chair or you're doing a squat like I just did, they would kind of be like this. The ligaments are more straight across, but as you stand up, they twist. So what this is showing you is it's a lot more stable of a joint when you have all of these twisting together. So if you remember the shoulder joint, that was a joint that didn't really have a really deep fossa, and what that allowed you to do is you could move your hand a lot. So it wasn't very stable, it was super mobile, and the opposite is true of the ox costa and the hip joint. Okay, so just like the ligaments of the shoulder joint, the ligaments of the hip joint are also named after the bones that they're connected to. So you have the femur here, and you want to ask yourself, is this a left or right? So what I do is I see that this is the pubis right here. This should come out in the front, and the femur should be coming more laterally. So I know that this is the right. Okay, so the first ligament is the iliofemoral ligament. So we know that this is the ilium up top here, and this is the femur. So it's just the joint right here that's connecting the two. So the next is the pubofemoral. So that's referring to the pubis. So the pubis, remember right here, this is the symphysial surface. So if you go right back here, this would be the pubis, and this would be the femur. So this is the pubofemoral ligament. Okay, so then the ischiofemoral ligament. The ischium is back here, and this is the femur. So it would be this one right here. And then the acetabular labrum would just be, it's kind of hard to see, I'll try to throw a picture. Remember how you had the glenoid labrum, which was just that piece of cartilage? So it's a similar piece of cartilage that is deep within the ligaments that provides more stability. Okay, so there are three gluteal muscles. You have the gluteus maximus, which is the most superficial. It helps extend the hip. It pulls the femur posteriorly. It's the largest muscle in the body. You have the gluteus medius, which helps abduct the hip. You have the gluteus minimus, the deepest. It also helps abduct the hip. So there are muscles of the posterior thigh. There are three muscles that make up the hamstring. All three of them are primarily involved in flexion of the knee, but there's a secondary action which is to extend the hip. Secondary because the gluteus maximus is the primary hip extender. So the first one is the biceps femoris, then you have the semitendinosus, then you have the semimembranosus. So the semitendinosus and the semimembranosus can get pretty confusing, but realize that one is superficial to the other. So the mnemonic is 10 over mem. Semitendinosus is over the membranosus, semimembranosus, which is deeper. Also, semitendinosus has a nice long tendon near the distal attachment point, and semimembranosus has a bigger muscle body. Okay, so that's all I have. I hope you enjoyed watching this video. I hope it was helpful. Let me know. Love doing these videos, so I hope you're enjoying them. I hope you're finding them helpful. Good luck studying. Let me know if you have any questions. Okay, shall we go on a little tour of the ox causa, which is this large bony bone.